New coronavirus cases are declining across most of the country, even in some states with vaccine-hesitant populations. But almost all states bucking that trend have lower than average vaccination rates, and experts warn that relief from the pandemic could be fleeting in regions where few people are inoculated. Case totals nationally have declined in a week from a 7-day average of nearly 21,000 on May 29 to 315 on Saturday, according to data from Johns Hopkins University. For weeks, states and cities have been dropping virus restrictions and mask mandates, even indoors. Experts said some states were seeing increased immunity because there were high rates of natural spread of the disease, which has so far killed nearly 600,000 Americans. We certainly are getting some population benefit from our previous cases, but we paid for it, said Mississippi State Health Officer Dr. Thomas Dobbs. We paid for it with deaths. More than 700 Mississippians have died in the pandemic, and the state has the 6th highest per capita death rate. Dobbs estimated that about 60% of the state's residents have some underlying immunity. So we're now sort of seeing that effect, Dobbs said, most likely because we have a combination of natural and vaccine-induced immunity. Just 8 states, Alabama, Arkansas, Hawaii, Missouri, Nevada, Texas, Utah and Wyoming, have seen their 7-day rolling averages for infection rates rise from 2 weeks earlier, according to Johns Hopkins University data. All of them except Hawaii have recorded vaccination rates that are lower than the U.S. average of 43% fully vaccinated, according to the U.S. Centers for Disease Control and Prevention. The 10 states with the fewest new cases per capita over that time frame all have full vaccination rates that are above the national average. Medical experts said a host of factors was playing into the drop in case counts across the country, including vaccines, natural immunity from exposure to the virus, warmer weather and people spending less time indoors. But Dr. Leana Wen, a public health professor at George Washington University, said she was concerned that the natural immunity of those who had been exposed to coronavirus might soon wane. And she's worried that states with low vaccination rates could become hotspots. Just because we're lucky in June doesn't mean we'll continue to be lucky come the late fall and winter, said Wen, the former health commissioner for the city of Baltimore. We could well have variants here that are more transmissible, more virulent, and those who do not have immunity or have waning immunity could be susceptible once again. In Mississippi, about 835,000 people have been fully vaccinated, or 28% of the population. But despite the lagging vaccination rate, the state's rolling average of daily new cases over the past 2 weeks has decreased by about 18%, according to Johns Hopkins. Dr.